Let's. Okay, good evening and welcome to today's discussion. So we're going to starting with viruses. So when you talk about microorganisms, you mention bacteria, viruses, you mention fungi, and each of them have clinical significance. Okay, medically, right? So um, let's look at some common viruses. If you are talking about viruses, basically they are classified into RNA viruses and then DNA viruses. Yesterday, I talked about HIV virus, okay, and I mentioned that it's an RNA virus, okay, and I told you the mechanism of action, how it navigates infection of the human cell and especially CD4 cells. Okay, so let's look at this question. Which of the following is an RNA virus? Papova, herpes, corona, adenovirus. So as usual, I'll put it in the chat. So you can comment your answers. I'll proceed from there. You guys should try and hasten up so that we'll cover more. You know, the faster your responses, the more interactive it becomes, the more we'll get to cover, and the faster we can cover more. So option C is correct. There are two ways of answering this question. Okay, you can outrightly know that coronavirus is an RNA virus. In fact, you should know because coronavirus is so popular that you shouldn't go for any medicine exams without having some knowledge. Like in 2019, 2020, when the coronavirus, even 21, when it was like you go for exam, you see like 10 questions on coronavirus. So up to now, they still bring some questions on it. So you need to be conversant with the virus, how it works, and the viral structure and everything. So it's an RNA virus. So you can outrightly know that it's an RNA virus. Then another way of getting the correct answer to this question is to know all the DNA viruses and then eliminate the one that is not a DNA virus. So the easiest way to know, remember I said there are RNA viruses, okay, and then there are DNA viruses. The easiest one to know because it has a mnemonic is DNA viruses. Okay, so by elimination, once you know the DNA viruses, you now know that every other virus is not a DNA virus, which means it's an RNA virus. Okay, so what's the mnemonic for DNA viruses? You guys should help me with it. Someone help me with it now. You guys haven't heard about happy viruses.
This is my first time hearing that, Chief.
Throughout medical school. So how do you used to remember DNA viruses? Okay. Okay, someone is already writing it for us from Airbody. So I'm happy DNA viruses. Herpes virus. Okay, that was the first one. Then hepadna, the meaning of that hepadina means hepatitis B. So hepatitis B is a DNA virus. Some, like, if you talk about hepatitis, there's hepatitis A, B, C, D, E. Okay, so some of them are DNA viruses, especially hepatitis B. Then the others are RNA viruses. But we need to confirm whether there's another one that is also a DNA virus. I think hepatitis D follows B, but check. Dr. San, help us check on everybody. So the second one, so herpes, every type of herpes, but herpes is a big family of viruses. There's herpes, human herpes 1, human herpes 2, up to 7 or 8. Okay, and each of them have names. So all this Epstein-Barr virus, cytomegalovirus, Kaposi sarcoma virus, all those viruses, all of them are herpes viridae. Okay. Then the herpes itself, the normal herpes that herpes simplex 1, herpes simplex 2, all of them are still under the big family of herpes viridae. Okay, so that's what this herpes stands for. Then hepadina is hepatitis B DNA virus. Okay, then A is adenovirus. Okay, A is adenovirus. P is, so these 3 P's now: pox, papova, and papilloma. So papilloma, the one, human papilloma virus, the one that causes cervical cancer, penile cancer, vulvar cancer, vaginal cancer, all those cancers. Okay, uh, it's this one, and warts, genital warts, and all the types of warts. Okay, that's this papilloma virus. Okay, human papilloma virus. Then the pox virus has a big class. Okay, all these monkeypox, smallpox, and so on and so forth. Okay, they are inside this pox viridae. Then the papova, what does that papova? Papova has parvovirus. There's a popular parvovirus that causes something in the body. Parvovirus B19. Okay, what does it cause again? Parvovirus B19. It causes like bone marrow suppression. Okay, so the person can have pancytopenia because of um, parvovirus B19. Then some people say the Y stands for polyoma, but I don't really regard it. So once you know the happy viruses, every other virus apart from these ones are classically RNA viruses. So from HIV, corona, rhinovirus, any class you can think of, all the RNA viruses, all those viruses that cause these common diseases, um, Lassa fever. Okay, so all those things, they are all RNA viruses. So when you say something is RNA, it means it comes de novo, like it carries, instead of in the nucleus, in the viral nucleus or genome, instead of carrying a DNA, to carry an RNA, expecting that when it gets to the body, it to find a way to replicate its RNA and then attach it into the body's DNA or something like that. So that's basically it. But a DNA virus will have DNA de novo, so it doesn't even need to convert anything. Once it gets to the body, to just attach it to the genome, to the cellular genome, and start replicating. Their goal is just to multiply. So they will find a way to put their genome into the normal human cellular genome and start. The normal human will be replicating his genome, not knowing there is already a virus attached to it, and then be replicating everything together. Okay, so that's basically what they are trying to achieve. Then for the DNA virus, uh, okay, you guys have seen it in the group. So hepadina, the other hepatitis virus are enhanced. So just only that hepatitis B is a DNA virus. The others are RNA viruses. And then there's also another thing I wanted to point out about hepatitis B. So A and E, hepatitis A and hepatitis E are oral. Okay, while B, C, and D are what? Can be gotten through injections and sexual intercourse and like all those normal this thing. Okay, route of transmission. But A and E are what? Fecal oral. And the way I remember it is that if you want to spell fecal oral, you write A and E, okay, inside fecal oral. So that way you remember that A and E are fecal oral. All right, so yeah, plastic anemia is the words. Okay, so the next question, let me also see how I'll talk about. Okay, there's a question here that is referring to the use of viruses as warfare. You can see now that China and US are fighting a Cold War. Maybe one day it will escalate. Who knows? So, which is not regarded as a biological weapon? Chickenpox, plague, botulism, tularemia. Let's attempt the question. Use your instincts, use your medical knowledge, and your ancillary knowledge. A little bit of history about some of these things will help you to, make take informed guesses. Plague was very important. Is it the 18th century or which century is that? Okay, it caused a lot of like when they will say people were dying in numbers in millions. Okay, that's plague. Um, Botulism is caused by Clostridium botulinum, right? And it can cause like gastroenteritis, food poisoning, and things like that. Okay, then tularemia is gotten from a pet. Is it a cat or which one is it? So the only one here that is common and everyday virus is chickenpox. Okay, so by extension, a lot of people have had. I'm sure if you check, more than 50% of the people in this um, chart have had chickenpox and have developed immunity to it. And once you have it once, you're not going to have it again, except the person develops immunosuppression, whereby chickenpox is called varicella zoster. Varicella zoster is also a pox. Um, it's also a herpes viridae. So VZV. So this VZV signifies the life cycle of chickenpox. Okay, so initially starts as varicella. So chickenpox, the normal chickenpox is varicella, which means the person is just ill, fever, the rashes, the classical rashes that comes in crops, okay, crops of lesions and all that, okay. When that is done, it's done. The person develops immunity to it for life, except the person develops immunosuppression, for example, HIV or AIDS and some other malignancies or something that can make the person immunosuppressed, right? Malnutrition and so on and so forth. So some of these viral particles are stored in the neurons, right? So in the cell body of the neurons in the spinal cord. So if the person has immunity, immunosuppression, the viruses will now begin to reactivate and come out through. They usually follow that contiguous nerve where they were stored. They'll follow that same nerve and now come to the skin and cause a rash. So it's called a dermatomal rash, dermatome. So it follows the dermatomes, which means it follows that same nerve. You know, in the body, there are dermatomes all over. So if you say T1, you know where it is. If you say C4, you know where it is. You say T4, and so something like that follows that dermatome to know. So from that dermatome, you'll be able to tell, okay, the virus is in so and so place, right? So that's the zoster aspect of it. So that's herpes zoster. When it becomes reactivated, it becomes herpes zoster. Then from that zoster, it can cause um, you know, tingling sensations, the rashes, okay, very painful rashes and all that. Then from that zoster, the third aspect of the life cycle is that it can cause, when the rashes have dried up, the person now continues having the paresthesias and uh, painful sensations around that same nerve roots or dermatome where the rashes dried up from. That's now called post-herpetic neuralgia. Okay, so that's the stages of this stuff. Anyway, so the reason why I'm mentioning is that is a common everyday virus. So all these other ones are not so common, so they are most likely to be used as biological weapons. Okay. Hepatic amebiasis, option A, left lobe, left lobe of left lobe is commonly affected. Liver function tests are of diagnostic value. Jaundice is uncommon. Serological tests are not helpful in diagnosis. So you're looking for the odd man out. Okay, so let us ask Airbody, our tutor. So um, all of them are like jaundice is not uncommon. It's a common symptom. Serological tests, such as antibody tests, are not very useful in diagnosing hepatic amoebiasis. So that's a true statement. Liver function tests are of diagnostic value. That's also a true statement. So things like alkaline phosphatase, bilirubin levels can be elevated in hepatic amoebiasis. but they say that the right lobe of the liver is more commonly affected in hepatic amoebasis. The right lobe is obviously bigger than the left lobe of the liver. Well, we need to find out why there's selection for the right lobe. Why does has a more direct pathway to the right lobe? So, like the portal vein has, direct pathway to the right lobe. This allows the amoeba to enter the liver more easily and settle in the right lobe. Okay. Yeah. Okay. So it depends. Maybe the person that recalled the question made a mistake. Okay. So there seems to be two answers that are, seemingly false. All right. Probably to be clearer um, in your exam, but now you know the theories behind it and how to think about it. But oh, this is false, and this is also false. Okay, wait. There's also a way you can think of this question. Okay, so if you are looking for the correct answer, I think that's a way you can look at the question. You are looking for the correct answer. You've seen that this one is false. Liver function tests are of diagnostic value, which means that one is also false. Do you get? Because you obviously need liver function test. So, like the odd man out is this one. So let's reevaluate. So jaundice is common, which means it's not uncommon, which makes this answer false. Liver function tests are of okay. It says are of diagnostic value. Probably, maybe the way it was written, maybe they would have written liver function tests are not of. I'm suspecting that that's what would have been written, and not of diagnostic value. Then left lobe is commonly affected, which is also false. Okay. Just once you just understand the basic principles, then you can answer it when you see the main question, right? Then serological tests are not helpful in diagnosis. So like there's actually no serology that is well known to be useful in making diagnosis of amoeba, hepatic amoeba. Okay, so This is the only correct, like directly correct if I change this option to not. Right, so let's work with that. Cryptococcus neoformans is a fungus, produces hepatosplenomegaly, uh, a higher bacteria, treated by IV lamivudine. Let's see those who are paying attention. What is lamivudine? What class of drug is lamivudine?
Lamivudine is nucleoside reverse transcriptase inhibitor.
Yes, just like zidovudine, stavudine, some other ones, emtricitabine. So yeah, it's a fungus. Okay. Which of the following is not a complication of infectious mononucleosis? Which organism causes infectious mononucleosis?
Um, I think Epstein-Barr virus can cause infectious mononucleosis.
Okay, yeah, it's Epstein-Barr virus, EBV. But CMV can also cause it.
Yes, sir.
Okay, but the commonest cause is EBV. All right. So, what is not a recognized complication of um, IM? Guillain-Barré, meningoencephalitis, myoclonus, transverse myelitis. So, we'll go to everybody. Guillain-Barré syndrome. But Guillain-Barré syndrome is actually associated with infection, but I think it's a bacterial infection in the GI, upper GI or upper respiratory tract infection. With which infections? So this one, Campylobacter jejuni, is the commonest infection that is associated with GBS, okay, accounting for 30 to 50% of cases. So it's almost synonymous to GBS. So once you hear GBS, you mention Campylobacter jejuni, and it's known to cause like gastroenteritis. So if someone start having, because GBS is like ascending paralysis from the lower limb up. Okay, so if someone starts having neuropathy, paralysis, and all those stuff after a gastroenteritis, maybe like 1 to 2 weeks after an episode, and then you suspect Guillain-Barré syndrome. So other bacteria like Haemophilus influenza, strep pneumonia, mycoplasma pneumonia, and then influenza vaccine, okay, has been associated with GBS, although very low risk. So, but no infectious mononucleosis. There's an O and G question. Fitz Cortis Hugh Fitz Hugh Cortis syndrome is caused by what? When you see an organism with the name coccus, what does it mean? No, it doesn't mean that it's in cluster.
That means it's circular.
Yes, it just means it's shaped in a round,
form.
just like a ball. Why bacillus is like rectangular organisms. Okay, so now the other things about being in clusters or being in, um, you know, in chains, that's a different thing entirely. So like staphylococcus is in clusters, so they will just lump together. Secular bacteria just lumping together. Okay, that's cluster. Then streptococcus is in chains, they are in strips. They're not secular things just being in a single file. There are some like there are pneumococcus that is a diplococci. That means two um, organisms. They are in pairs, husband and wife. Two, sequel, two, like that, diplococci. So something like that. Um, you guys are not attempting the question.
Madam, okay. Madam, can you see that I'm doing something? Can you just wait? You will see.
Course
I
is
will read the result. I talked to him. Just wait 1 second. You will.
So what's this syndrome? It just means that the liver is taking a hitting from the pelvic inflammatory disease that is going on at the you know female genital tract. So that's inflammation basically. Inflammation of the liver capsule, okay, in a patient with pelvic inflammatory disease. Okay, this is examiner's favorite. Still on viruses and things like that. Vaccination. Okay, so which is not a live vaccine? They will ask you this question in different ways. You know, they will tell you a pregnant woman came to the hospital and blah blah blah. You want to give vaccine. Which one are you not going to use for a pregnant woman? Which one are you not going to use for an immunosuppressed patient? Maybe they'll paint a picture of HIV, AIDS, or something. Which one are you not going to use? So you don't use live vaccines in pregnancy. You don't use live vaccines in immunosuppressed people. So you just basically have to be careful with live vaccines because they can be reactivated. So which is not a live vaccine, which means three out of these four are live vaccines. They know you guys know yellow fever. Everybody knows that yellow fever is a live vaccine. So they did not put it in the option. So which other one? Yellow fever. Live vaccines. Yellow fever. MMR. What's MMR?
Measles, mumps, and rubella.
Yes. Then OPV. There are two types of polio vaccine. There's IPV, okay, and there's OPV. OPV is a live vaccine. Uh, OPV is also called Sabin's vaccine, while IPV is called Salk. Okay, so IPV, OPV is a live vaccine and it's given orally. That's the one they give, that's that droplet they give to children, to babies. Like if you see people that are doing immunization, they are going around oral polio vaccine is the OPV. They actually, that's when they were doing that program, kick polio out of Nigeria or something like that. So this was what they were giving. They would drop it into the mouth of the child. All right, so influenza is the only odd man out there. I've already given you the answer. Maybe you people are still waiting for it. Let's see. There should be more live vaccines. List the live vaccines. Then classify other vaccines, vaccine types. In tabular form.
I'm doing something now.
So that reminds me. That reminds me. There's also another question, another version of this question where they ask you, which of the following is not um, okay? Which of the following is a live bacteria? Okay, Bacillus among the live vaccines. Okay, the Bacillus calmette-guerin, which is the BCG vaccine, is the only bacteria amongst them because it's tuberculosis that was, purified and made into a live vaccine. That's what they use for BCG. Okay, so that's how they will ask it, and BCG will be the answer because it's the only bacteria amongst them. Every other thing here is a virus. MMR, varicella zoster, varicella vaccine, that's chickenpox vaccine, mumps vaccine. They give MMR and there's still a separate mumps vaccine. There's still a separate rubella vaccine. Okay, but you know that this MMR is preferred because it has everything and you can give it at once. OPV, we've mentioned it. Rotavirus, vaccine, also a live vaccine, and yellow fever vaccine, the most popular one everybody knows. So the other classifications: live vaccines, inactivated vaccines, okay, like killed, they call it killed vaccine, killed inactivated vaccines. Influenza can also come in there, HIV, pneumococcus is killed, and HPV. Conjugate vaccines, things like the coccus, the cocci, these organisms that have coccus, if you want to protect, because they protect against the lungs. So vaccines that what happens is that all these pneumococcus and meningococcus, they affect the patients that have splenic injury, or that people that don't have spleen, basically like asplenic patients, like in sickle cell disease or something like that. HIB, Haemophilus influenza type B. Okay, so you need to give them these conjugate vaccines to protect them from polysaccharides, whatever, polysaccharide organisms. So you give them this vaccine to protect them from it. Then subunit vaccines, where they just pick a subunit and use it, is hepatitis B, human papilloma virus. Okay, then toxoid vaccines. There are some toxoids. We know tetanus toxoid, that when you see a patient that has injury anywhere, the first thing that will come to your mind, okay, have you given TT? Let me give TT. And so that TT is tetanus toxoid. So it's a toxoid vaccine. Diphtheria toxoid is also another toxoid vaccine. Okay. It can come as diphtheria alone, and it can come as DPT, diphtheria, pertussis, and tetanus. They are all toxoids, so they can be given together. That's why there is a DPT vaccine. Then recombinant vaccines, hepatitis B is a major recombinant vaccine, but HPV is also there. But hepatitis B is the major recombinant vaccine. So anyway, you see a question on that, think of hepatitis B first. All right. Okay, this is a pharmacology question coming up. Rifampicin is used in blah blah blah. So rifampicin is used in all except Legionnaires disease, chemoprophylaxis of meningococcus, meningitis, leprosy, and Bartonellosis. So apart from TB, rifampicin has other usefulness. It go shock una. So it can be used as chemoprophylaxis. Just like ciprofloxacin can be used, rifampicin can also be used as chemoprophylaxis in meningitis, meningococcal meningitis. Okay, so if you come in contact with someone who has meningococcal meningitis, it's very important to take chemoprophylaxis, either with ciprofloxacin or like single dose ciprofloxacin or single dose rifampicin. It can obviously, like leprosy and tuberculosis are cut of the same cloth. Okay, they are both mycobacterium, so there's some interoperability there. Okay, another pharmacology question.
So, Chief, this question now becomes which one? Is it D?
Yes, I've circled D.
Okay.
It's Bartonellosis, that is the off one. For Bartonella, you use doxycycline, azithromycin. Viagra, some of you may have used this medication, but you don't know the mechanism of action. So now it's time to tell us. Okay, so yeah, it's prostaglandin E5, of course. It uses this prostaglandin E5 to cause vasodilation. Okay. Endemic fluorosis is featured by all except exostosis, kyphosis, chalky opacities on the enamel, um, osteoporosis. Fluorosis. They're basically asking for the clinical features of endemic fluorosis. So endemic fluorosis is basically like when they have bone growth and all this other stuff that they're talking about. So osteoporosis is not part of the clinical features. Exostosis just means that new bone formation is just growing somewhere. Kyphosis, that's spinal curvature. Okay. Hunchback. Um, Chalky opacities on the enamel. Okay. But on the other hand, like this one, there's even formation of more bones and all that. But osteoporosis is like loss of bone. So that's the other one else. These are what we call examiner's questions. So if you have done well on the candidate's questions, you will not bother about examiner's questions again. But you still take a good educated guess. There's a phenomenon called accidental hypothermia. Has been found in all except one. Which one is that? Accidental hypothermia. if you look at all the symptoms, they are hypo things. Okay. Only one is a hyper, which is Cushing syndrome, elevated cortisol. This one, myxedema, is like hypothyroidism. Pituitary insufficiency, which is Addison's disease. Okay, is expected to have someone that has pituitary insufficiency. Person will have low everything, low blood pressure, low pulse, low blood sugar, low energy, low BP. So even loss of consciousness and fainting. Myocardial infarction will also present with something similar. Okay. So Cushing syndrome. So there have been stories of people who put on the generator very close to their house with very poor ventilation. They went to bed and didn't wake up the next day. We're talking about no other than carbon monoxide poisoning. So all are modalities of treatment in carbon monoxide poisoning except hyperbaric oxygen therapy, physostigmine, artificial ventilation, blood transfusion. These are all modalities. Yes. Physostigmine. What's physostigmine used for? It's also an MCQ. Neostigmine, physostigmine. Are you saying it's used for anticholinergic or you're saying it's an anticholinergic? The way I look at it as an anticholinergic. So it's double anti. Okay. It's an anticholinergic. So when you have cholinergic hyperactivity, when you have anticholinergic poisoning, you now use physostigmine because it helps to regenerate the choline, acetylcholine. Okay. So the classic presentation that will necessitate you to use physostigmine is a patient that had insecticide and poisoning, like in the case of maybe spraying insecticide and then getting poisoned, or people that use it for farms, weed killers, and all those stuff. They can get poisoned. So, and those medications work through anticholinergic mechanisms. So, physostigmine will now be anticholinergic and is used in that situation, including those who attempted to end it all. Okay. The next question. During infusion of an acidic solution, which contributes most to buffering? Phosphates, proteins, bicarbonates, none of the above. Neostigmine, ribostigmine, physostigmine. Yeah, because they are intracellular, they will not have effects in the extracellular environment. Hmm? What was the answer? Question says which contributes most. Let's verify from everybody. Okay, I was reading you guys this thing as intracellular proteins. Yeah, so bicarbonate buffer. All right. Hazardous effects of excess heat, which is false.